Jared 200, how are you? It's summer 2019. This is the week of June 10th. And note that your next CT that's coming up that is due is the 17th. That's a week from Monday. Okay, so that's next Monday. And it piggybacks on our assignments for this week. And the assignments that we're going to be discussing this week, we're going to moving into the brain. Okay, and I'm going to move myself over here. And so we dealt with the major diseases that affect aging, okay, and how aging modulates all these diseases. They're called age-related non-communicable diseases of aging. Okay, we did cancer, diabetes, and diabetic heart disease. Okay, now we're going to be moving into the brain and diabetes and Alzheimer's disease, as well as diabetic heart disease and Alzheimer's. So these three, and this, are totally linked. If you'll see when you do your next CT, we ask you to address this, and I'll get there in a second. And 80% of all Alzheimer's cases, the people are diabetic. And so there's a direct link to a vascular problem and inflammation and Alzheimer's disease. So, and then you ask yourself, which communities, which groups are more vulnerable. Okay, the underprivileged people have diabetic that goes unchecked, goes untreated. Okay, it cuts across races, and so the statistics that we see linking diabetes to how impoverished you are or your race, we see that it targets or links directly to Alzheimer's. All right, so we're going to go into this section right here. I'll be putting this video right there. And we look at the assignments, okay? So again, what we've done here, this is a PDF file that covers this website, so you can go either way. So the first thing we do is we deal with mental health issues, okay? And it's a real quick read here, and we can click right there, and as it loads, so we just want you to kind of have this open as you're doing your quiz. And so we look at the likelihood of having mental health concerns. And there's a lot of mental health issues. There's anxiety, there's depression, there's bipolar disease. There's dementia, which is a mental health concern. So these are all captured in this statistic. But we see that, over the age of 55, we have roughly 1 out of 5 people, 20%. Okay, and when we look and we ask ourselves, what's going on? Why does the older population need assistance? Why do they have things like clinical depression? And it's pretty clear cut. What happens when you get older? You just the act of growing old, it can be really, really difficult. As an athlete, it's been really, really hard for me. Losing my athletic ability. I've had a lot of injuries in the last couple of years, and you can lose your spouse, and that is, your everything, and so that's really difficult. Loss of mobility, loss of independence, and all these cause mental health issues. So these are appropriate links to depression. Okay, we see how much higher a likelihood of suicide in the older depressed. Okay, so I have a little construction going on in the other rooms. I apologize for that. But we look at here, this is the National Institute of Mental Health website. This is not for you, but this is for me. And we look at, the rate. So at any one point in time, if we were to look and see who's depressed, and for clinical depression, we see that the numbers are really, really high for your age group. Okay, and this has to do with brain development. And then we see that the rate of depression goes down like so. And this is looking at ethnicities. This is looking at gender. Women are much more likely than men. And if we were to hone in on this developmental time period, you can scroll down here, and you can see that again it's aligned with development and going through puberty, and hormonal changes affect how your brain is wired, and it's also a unique time for loss of independence. Okay, alrighty. And the reason that I'm honing in on this is this. We can go back over here to the website. We come down here and we look at mental health and clinical depression, and we see even though this age group has a very high depression rate. We see that again. This is S per 100,000, so it's not percentages like we were looking at on the other graph. We see that older people are much more likely to commit suicide, and that's what's illustrated in this graph right here. So it's a very real deal, okay? And these are looking at graphs, at 2 different time points, and you see it's very, very, very consistent. All right, so I'm going to go back to the American Psychological Association. So we just want you to familiarize yourself with this concept of depression, and then like I said, a big part of mental health is, and that statistic is dementia over the age of 55. We see that 1 in 5, like I said, have mental health issues, and we're going to talk a little bit in a second about Alzheimer's. Okay, we see substance abuse that piggybacks on mental health. Chronic illness, like I said, something like arthritis, if you're an athlete, can really get after you. So we really need, and they summarize the end, a lot more people that will specialize in this, because as you've learned from this class, there is a gigantic growth in the segment of older people, not only in our country, but worldwide. Okay, again, I apologize for the construction. Okay. Alrighty, so then we want you to launch into Alzheimer's, and you need to just treat this the way you would any type of online interest. And so you click in here, and we want you to navigate these and learn. Okay, and there's a couple of different ways to do this. Okay, so you can go into each of these and learn what's going on. And again, I apologize for the noise in the background. This is a great way to start. You just go into the Alzheimer's disease fact sheet right here, and so you can go through each one of these and really learn what you need to know for this course. So what are the changes that happen in the brain? Okay, so this goes over all this. Okay, mild cognitive impairment precedes the different stages of Alzheimer's that people go through. What are the signs and symptoms? That's what that's all about. Okay. We can look what are the causes of Alzheimer's. Okay, and this is a video that we also post later on. And it talks about the pathology, okay? It talks about the genetics, okay? It talks about health and environment, okay? People exposed to toxins are more likely. Heart disease, stroke, high blood pressure, these are all conditions. Diabetes, like I mentioned, okay? If you have a good diet, you're physically active, you're socially engaged, okay? You're mentally engaged, okay? Then this reduces the risk. This goes about the diagnosis, what we use. There are some imaging tests that can be done, but this is only for late stage diagnosis. Early stage is done through a mini mental status exam. Okay. Alrighty. So and there's support for caregivers right here. So that's, again, click backwards, and so that's one way of modulating this. Okay. So. All right, so I'm going to go back in here, and I encourage you to, as you go, you can go in and look for all this. Here's a great thing, the clinical trials, and I encourage you to look into that, okay? Treatment for Alzheimer's disease, what is out there? So here's some new articles about how Alzheimer's is treated. This is a great article right here about the drugs and the strategies we're using for treating Alzheimer's disease. So this is what you're going to have to go through and figure out, okay? These are a fairly old class of drugs that modulate brain activity. They're called drugs that inhibit this drug called cholinesterase, and they increase the amount of one transmitter in the brain. And this is another second category of drug that it was hoped to slow the progress, but it really hasn't. And that's it. And these are fairly old drugs, and it's a really kind of depressing situation. A lot of the major drug companies are not doing drug development because it's so costly. Because you have to study people for such a long time. So this is that same video that I showed you about the mechanism you should watch, and this video right here is about the facts. It's a short video. You just come in here and it just goes through statistics. You see it's only right here, 1:49. It's pretty staggering statistics, okay? Alrighty. So this rifles through the statistics. There's a little bit of extra going on here in terms of the stats, okay? And then we repeat the statistics down here in this section right here, okay? And very helpful for when completing your quiz. All right, so from there, this is an impact video. All right, so this talks about, this is for about a little over 7-8 years ago, and somebody whose wife has Alzheimer's and how it impacted him as a caregiver, and these are just some sociological, economic numbers that we try to throw out there. And a big part of the loss is you as a caregiver. So you may have to do this, or your family member may have to do this, and you're going to lose productivity at the workplace because so much of your time is being devoted for the care of the individual. This is a really, really cool documentary, a must documentary about caring for somebody at a facility and how they're using music therapy. Again, this is from a few years back, 2014. Alrighty, guys. I really want you to engage in this. Unfortunately, as we are doing so well in eliminating all the other diseases of aging that we've discussed in this class, people are surviving longer, and so now Alzheimer's is becoming the real deal. When we look at people over the age of 65, it's 1 in 8. People over the age of 85, it's 1 in 3, and those are pretty staggering statistics. It's something that is being laid in your lap. It's something that you're going to have to deal with, and on an individual basis, also on a society level, when you're looking at what's coming down through Congress and the Senate and our government in terms of helping people. Alrighty, okay, guys, take care, and we will see you next time.